Okay, my name is Saumya. Actually, I have completed my Nclex Australia, Upra Nclex. I have cleared in last year. Currently, I am working in Trivandrum and my home place also in Trivandrum, settled here. Okay, and now I am under the processing to USA. So hope for the best, whatever it's coming, we can do that. Okay, we can start it. We can wait. Okay. I'm starting because I want to complete it on time. That's it. Okay. Here I just want to tell you about, give an overview about the Nclex examination. We know that previously it was a old generation Nclex examination in which only multiple choice questions were there. Okay. But nowadays, after 2023, it has renewed into new gen Nclex examination. In that, they will provide some what scenario based questions. Okay. Actually, this mainly Nclex examinations mainly focusing for the hiring of internationally qualified nurses. Okay, and the countries which are means the main requirement for the exam is USA, Canada, and Australia. These are the main three countries which prefer Nclex examination. And before that, each country has different board of nursing and organizations which will conduct this NCLEX examination. This exam is conducted by the word means Pearson View. So we need to take a open an account in the Pearson View. Then only we can schedule the exam. They only conducting this examination. And the main this exam criteria and the exam is modulated by the NCSBN. Okay, that is a US centered body that is mainly focusing on the criteria because they want internationally qualified nurses, because not only a bedside nurse with a limited knowledge, they want knowledge in all the areas. So that only they have changed the question into different model, that most of the questions are scenario based, and that different types of questions are also there that I will tell you. Okay, and I just want to tell my about my institution, that we are providing that NCLEX preparation. Actually, we are using some mind strategies also, that for the analysis of the question. Actually, most according to the research, it is showing that 87 or almost not accurate 87, about 87% of the nurses are failing this examination in their first attempt. Actually, this examination is not that much difficult. Okay, because we need a Nclex syllabus. So we should learn the theory in a in a narrative way, which is based on the syllabus based theory. There is no need to read the what theory in a vast way. We need to focus on the particular highlighted theory, but we have to read any Nclex focused books. For example, Lippincott is available, Saunders 9th edition is available. Okay, we can read that, but in addition, we should point the word highlighted points. We need to be understand clearly. Okay, then only we can get a clarity about the examination. And one more thing, that we can't crack this exam by hearting or mug upping the theory. It won't help us. Just we need to understand the what question scenario. We need to understand the scenario, understand the question, and for that we should have a the theory. That is the already we have learned theory during our nursing education, and after that we are learning many things. Already all these things are in our subconscious mind. We have to put this theory and apply it into the scenario and evaluate the scenario by correlating the options which are given, and we can find out the correct answer. Actually, it is not happen like once in the Rome was not built in a day. Like that only we can make it into a track, because we need consistency. Okay, initially we may feel some struggle with the question analysis. Theory we can learn easily, but when we attend the class, we may feel that it is okay, we understood everything. But when we start to analyze the question, at that time we may find difficulty. Is it, is I'm telling true or any false? No, it's correct only. That is the speciality of this Nclex examination, unlike other competitive exam. Here we need some higher level of thinking, higher level of clinical evaluation. That is the special model, clinical judgment model it is applying here. Okay, so our institution here, we can ask to our students also. Actually, we are focusing on such criteria, and we are putting this, we are boosting it into a what? We are making to boost up the critical thinking in the student. Okay, that like that we are make them to practice even in the class itself. So, and for this webinar, my primary goal is to give a what? Most of the students are very fear about this examination, like a feeling that it is a difficult examination, I can't do that. No, it is a wrong myth only, because we can do it. Even though it is a difficult examination, that is 100% true, but we can make it easy. Okay, by using strategical approach, by analyzing the questions, by learning Nclex focus theory, we can make into a easy, and we can learn or we can crack it in a simple way, not in a complicated way. We can make the theory in a simple way. We can understand the theory so that we can apply the theory in the scenario based questions, and we won't get any fear or tension about the examination. If we are attending or if we are taking the classes, initially we may find some difficulty, but after that when we started our question analysis, we will become on the track, because we have to apply some strategical approach in the question analysis. Okay, we can move on that. Before that, before moving further, I welcome you all for joining for this webinar. Thank you all. Okay, so we can learn how this Nclex examination is going. Then, I already said that most of the nurses are failing this examination. That is not because of it is a difficult one. That is not because of the lack of knowledge, lack of question practice. Okay, because when we ask about this practice in about those who are preparing for this Nclex examination, they will usually say that I am practicing 200 questions in a day, I am practicing 300 questions in a day, and I have completed 5,000 questions in one month. No, that won't help you. Okay, if you are practicing, even if you are practicing daily 85 questions, and if it is in a right way, okay, here we need smart work rather than hard work. We are spending our time for question analysis and learning theory. Okay, so we need to utilize, so we need to make it in an effective way. So that one strategy we need to practice that. If we are doing an 85 questions, okay, and some questions will be right, some questions will be wrong. Okay, if it is in a tutorial mode exam practice, we can read the rationally of the right option as well as the wrong option, so that we can understand why this option become right, why this option become wrong. Like that we can, but that rationally will helpful to give answer to another question. Because even when if we are practicing one question, we will get a nutshell theory from that question itself. That is the speciality of the Nclex examination. Okay, so we need to focus there, understand the scenario, understand the question, read the option. Again, we need to understand the question. Sometimes the students will they will rush to the answer. They won't think even in 1 minute. Okay, they will rush to the answer, so that they will find difficulty in correlating with the options. Here we can use elimination method. Okay, some strategical approach, if we are applying it, we can make it in the easy. So such mistake we won't repeat while practicing question. If we are doing so, we can crack it so easily. And some keywords while reading the scenario, and here we need to use some skimming. First we need to use skimming, then scanning. Okay, while skimming itself, we can understand the keyword from the question. So if we are finding the keyword and locating the scenario, there we should scan the scenario. We will get the correct information. But most of the students are not aware about it. No one is share this information. The student will struggle with the even Actually, the case study questions, most of the questions are 6 series question. So the student will find struggle on the particular question, and they will sit in by seeing the scenario, by reading the scenario. So at that time, the student failed to what manage the time. Actually, our question, this Nclex examination is total 5 hours examination, minimum 85 questions, maximum 150 questions, and the system will shut down at according to a performance. It is a peer score evaluation. If our performance is in a higher than the peer level, we will pass the examination. Sometimes it can shut down the system in the 85 questions. Sometimes it can reach up to 150 questions. But we can't get an idea about whether we pass or fail. That we can't get an, because there whatever the questions are coming, going, we can't even remember what are the questions are coming. And one more thing, that the system, if it is shutting down at the 85 question, that doesn't mean that we have passed the exam. That doesn't mean that we have failed the exam. Okay. And it can reach up to sometimes 90, sometimes 100, sometimes up to 150. In these days, most of the students are getting the question up to 150 question. So it will take about 5 hours. If the student have mismanagement in the time, what will happen? The student can't complete the exam, because if they are spending a lot of time in one question. Okay, so the question actually the student's performance level is too low or too high, the exam will get tight, because what they will try to understand the our but level of knowledge, critical thinking, problem solving, clinical judgment, okay, infection control, prioritization, delegation, and there are so many criteria are there, whether we are able to we are giving correct answers to each question. So they will continue giving questions where they are getting an idea about our level of performance. Okay. So keep in mind that always we should focus on the time, as well as focus on to giving maximum right answers. If you are confused with if it is a SATA question, for example, SATA means select all that apply. So if it is a SATA question, if we are giving a lot of time, or if we are making mistakes, what will happen? We will get a negative marks. If the question is a 3 marks question, okay, and if we are giving 2 wrong answers, how many marks we will get? We will get 1 mark only. Okay, if it is a 2 mark question and we are making 2 wrong answers, we will get 0 mark. Okay, and some, for example, the question, if we, it is a 3 mark question and you attended 4 options. Okay, and the 3 were right and 1 was wrong. How many marks you will get? Because you got 3 marks for the 3 right answers, but at the same time you attempted 1 wrong answer, so 1 mark will be deducted from that 3 mark, so you will get 2 marks only. That is the what criteria of the negative marking. So some question types have negative marking, so always they will mention it plus or minus. So you have to think that if such question, if you have sure at least 85 to 90% sure about that particular option, you can select it. Okay, so that we can make in a practice. By making practice, we can make it correct. Okay, so don't worry. So these are the common mistakes the students are what making. One thing, overthinking the question, because thinking in the same question for a long time, it will mismanage the time. Second, on some keywords the student will not get. Even question they will ask in a different way. Okay, sometimes they will ask in a statement ways, which is the correct statement, which is the wrong what actions done by the nurse. Sometimes they will ask which is the action by the nurse is intervened by the charge nurse, like that. Okay, some questions will make it into some confusions, but if we have a quality to read the question and understand the question clearly, we won't get what wrong answers. Okay, if we are attending a right answer, sometimes if we are not understand the question correctly, the answers will get wrong. Okay, so next. Then this one thing, this Nugent Nclex examination, this NCSBN is applied some criteria. For example, some clinical judgment model evaluation. That means we have to efficient enough to evaluate the condition of the patient, whether it is improved, whether it is worsened, whether the condition is unchanged. Like that, we should be able to critically analyze the condition of the patient. So that is clinical judgment. And here we can't memorize anything. Okay. For example, today I will give you an overview about the myocardial infarction. So we will think that we can by heart the theory. Okay, of course we can by heart the theory, but that won't help in the question. When you are going to analyze the question, you feel struggle because you are not clearly understood about the theory, but so you will find difficulty in applying this theory in the clinical area. Okay. Next, this most of the questions, scenario-based questions are real-life questions. So that we all are working in the hospital. We all daily meeting so many patients. So here the questions are also scenario-based question. So we have to think that we are the nurse who is supposed there. If we are reading a scenario-based question, you have to think that if it is mentioned one nurse, you think you are the nurse who is giving care to the particular patient in the given question, so that we can easily understand the scenario. Otherwise, if we are reading, we will get some panic, anxiety. Okay, so don't put extra effort in understanding the question. Just you keep in mind that it is a real life scenario. So just visualization. That is the important mind strategy we have to use it. If we are even reading a question, that picture or that clear clarity visual should be in your mind so that you can understand it easily. Yes, understand it easily, and when reading the question also you won't find any difficulty. Okay, so some questions are partial credit only, but if you are for example, if the question is about for getting 2 marks, okay, and you have selected, if it is a what select SATA question or drag and drop anything, if it is a question for 2 marks, but you have selected 3 options or 4 options. Okay, what will happen? That you will already you got 2 wrong answers, so you got 0 marks only. And if you are again you are selecting the wrong answers, it won't go into negative marks. Okay, that marks will reach up to 0 only. Understood? And extra negative mark will not be deducted. If you are giving this wrong answers, you will get a partial credit. Okay, and this we have to focus on the criteria aspect. First thing we can see this NCSBN criteria. This is the clinical judgment model. Only the thing is that we have to clinically judge or clinically understand the progress in the condition of the patient. Okay, here we can see that for that one more thing after this I will think. This is the Bloom's taxonomy, which we are mainly focusing on the Nclex RN examination. First thing, remember we already have some learned theory in our subconscious mind. Okay, while seeing the patient or while reading a question, we need to understand the scenario. Okay, then what you need to do is the learned theory or the whatever is coming into your mind, which is already learned or experienced in your previous days, that learned theory you need to apply it in the particular scenario. Okay, understood? The learned theory you have to understand the scenario. Okay, and the learned theory you apply it in the particular scenario. After that, what you have to think that when you apply the theory in the particular clinical event, you have to analyze it. Okay, for example, if a patient patient is brought to the emergency department, you know that if the patient is having the heart attack, the patient will get chest pain, the patient will get what there's dyspnea, saturation fall, like that. Some informations are already in your mind, but you have to analyze this learned theory with the patient. For example, some patient may not feel the radiation to the left hand. Okay, usually we have learned the theory that when the patient is getting heart attack, what will happen? Patient will get the chest pain and it's usually radiating to the left hand jaw, back of the neck, like that. Okay, But some patient will experience only squeezing pain only squeezing, minor. And some diabetic patient will get silent attack also. The thing is that you need to analyze what by assessing the vital signs, by assessing the clinical, the diagnostic measures, by assessing the lab values. You need to analyze the condition of the patient. Understood? Any doubt till now what I am discussed till now? Anyone have any doubt? If you have any doubt, you can ask to me. Okay. So then that means whatever the theory we have learned previously, we have to apply it in the clinical scenario. Then after that, we have to analyze the condition of the patient, because what are the problems which are we have already learned in the theory, and what are the problems which is experienced by the patient. Like that, we have to analyze. Okay, analyze the particular scenario. After that, we should evaluate. Okay, oh, okay, this much symptoms are present in the patient. So after that, we will we will get an information that this is the condition of the patient. Like that, it will help to formulate a diagnosis. Finally, what will happen? We will diagnose it as a the myocardial infarction. Like that, we will create one the judgment model. Understood about the Bloom's taxonomy? This is called Bloom's taxonomy. It is mainly using to boost up in our critical thinking. Actually, it is not happened in one day. We have to apply it in a daily basis by practicing questions. Then we will become on the right track. Okay. And next one, I will, the same thing only is the clinical judgment model. That means the learned theory, we need to apply it in the scenario which is given in the question, so that we can easily understand. Okay, we have to formulate hypothesis. The hypothesis means we can formulate the nursing diagnosis, then we can analyze the cues, what are the conditions in the patient, and we have to correlate with the patient, then evaluate the outcome. Outcome, how we can evaluate that? For example, if we are giving for a dyspnea patient, we are giving a Fowler's position. Okay, what is the primary management for the patient who is experiencing dyspnea? So we need to think in our mind, or we have a rationale behind each action. Each and every steps in the nursing, it is a evidence-based practice. Okay, nursing is the evidence-based practice. That means each and every steps in our nursing has a rationale. Always think about the why question in our mind. Whatever the care we are giving, whatever the situations which are explaining in the scenario, you have to think in your mind about why it happened. For example, if you are seeing a trend in the vital signs which shows the for example, when the patient has received, at that time patient saturation level was 88%. Okay, then after giving management, okay, you got the saturation as a 98 patient. And by analyzing such situation, what you feel, whether the saturation is improved or worsened? I want response from you, then only it will become effective. Okay, anyone can respond, no issue. Okay, so if it is a saturation change from 88% to 98%, what it indicates? The condition of the patient is improved or worsened? What it is?
Improved.
Worsen.
Worsened. The previously patient
Improved.
saturation was 88.
Improved.
Improved. Very good. Improved. Because in a normal
Where
adult.
from where?
Okay. No issues, Sumit. Thank you for responding. In a normal adult, the oxygen saturation level is 95 to 100%. Okay, except COPD. In COPD patient, the normal oxygen saturation level is 88 to 92%. That is the acceptable oxygen saturation in the COPD patient. All other patients have normal oxygen saturation 95 to 100%. Okay, so if the patient has a dyspnea and we have administered Fowler's position, and we administered oxygen. After that, the patient oxygen saturation is improved to 98%. That indicates that the patient condition, that the patient, that the clinical condition, that means the dyspnea has improved. That means patient breathing is got improved. Like that, we can evaluate the outcome. Okay, so that only I'm saying, whatever the care we are giving, we should have a scientific rationale behind it. For example, before doing any procedure, before touching the patient, after touching the patient, we are doing hand washing. Why we are performing hand washing? Anyone can tell me? What is the
Reduce cross infections.
is very good. Reduce the cross infection. Like that, even a mild single step. But this hand washing is a, we think it is a simple one, but it is the most important step. All the healthcare professional need to be followed. Then only we can save the life of the patient. Okay, so that I'm just want to make you understand that all the actions or whatever the care, whatever the condition of the patient, we have to assess, we have to analyze, we have to what, evaluate the outcome. Okay, so we can use Bloom's taxonomy, clinical judgment model, can this Bloom's taxonomy especially for boosting our thinking level, or the how may be the condition. Okay, for example, you are working in a hospital, if you are working in a what, any area, okay, for any what, ward or ICU, wherever it is. If you are seeing, for example, if the patient is complaining about pain, usually we will administer analgesics to the patient. Why we are administering analgesic to the patient? Because analgesic will what, help to relieve from the pain. Okay, so that only we are administering analgesic. For the patient who is complaining pain, we won't administer antibiotic, because antibiotic have different rationale or different role. That is, that prevent the infection, although that prevent the growth of microorganism multiplication. Like that, in what are the care we are giving, or what are the mention in the scenario, we have to evaluate it. Okay, next thing is that prioritization, the prioritization of needs of the patient. The most of the Nclex questions are based on priority based questions. For example, they will give 4 scenario patient, and they will ask which patient will taken care by the nurse first. Okay, otherwise they will give some clinical conditions or clinical symptom, the pain, dyspnea, like that, and they will ask about which is the most priority complaint which needs to be what, managed first. Like that, they will give some question. For example, if a patient is complaining with pain, and in Nclex examination, when they are giving pain information, always they will mention about the pain scale. For example, they will mention 0, in between 0 to 10. Okay, if the patient is having severe pain, it will be always greater than 7. If the client is having a moderate pain, it will be about 4 to 7 or 5 to 7. If the patient's pain level is below 4 or below 5, it indicates that patient is having mild pain, like that. But if the patient is having dyspnea and pain, which is the one we need to manage first? At that time, we will make it confusion, because both need to be managed in an immediate basis, dyspnea as well as pain. But at that time, in a confusing question, if you are getting, you need to analyze it. Analyze means you need to look out the scale, pain scale. Okay, and also you need to look out the worsened what, the breathing difficulty of the patient. If patient is having severe breathing difficulty, oxidation, that oxygen saturation fall, okay, we need to meet at that time. If the pain is moderate or mild, what things we need to manage first, dyspnea or pain? Which one? The patient has severe breathing difficulty with the saturation fall. Okay. And the patient is complaining pain also, and the pain scale is 4. Okay. And what will you manage first? Dyspnea or pain?
Dyspnea.
Dyspnea, because patient is having struggling to breathe. So at that time, breathing is the highest priority. For example, in another scenario, it is mentioning that the patient having severe pain, 9 out of 10 or 8 out of 10 pain. But patient is having mild dyspnea also, and the saturation is 95%. And which complaint you will manage first? Pain or
Pain.
pain?
Pain.
Yes, very good. They like that. We have to evaluate it. Before evaluate, actually for evaluating, we need to assess it. For assessing what, we need to have a what that understanding or recollection of the learned fact. So the learned fact should be applied in the scenario. Then we need to analyze it, evaluate the outcome of the patient. In the Bloom's taxonomy, what we are doing, we are formulating new diagnosis. Okay, that is in the Bloom's taxonomy. In clinical judgment evaluation, we will evaluate the condition of the patient by applying and analyzing the scenario or and the condition of the patient. We will evaluate the outcome. And in Maslow's hierarchy, we will prioritize the need. For example, we have all learned this Maslow's hierarchy in psychology, first year psychology. Actually, according to Maslow's hierarchy, we will meet the physiological need first. Okay. Before meeting the safety need or means love, care, support, goal, at our life achievement goal will come last only. Primary, we need to focus on the food, shelter, air. Okay. After meeting the physiological need, our priority will go to safety. Okay. Then only the love and care, then self-esteem. Okay. After that, our cognitive needs, then aesthetic need. The aesthetic means our spiritual needs. Finally, only our goal achievement, that is self-actualization needs. Okay. So here is heavy rain. I don't know. Next prioritization of the care is on the basis of ABC priority. ABC means airway, breathing and circulation. Okay. That means always airway should come first, or second breathing, third circulation. Like that only we now the prioritization of the needs of the patient. But however, we need to focus on in a scenario, or we need to focus on the condition of the patient. In some conditions, circulation may be the priority. In some conditions, breathing may be priority. But in some conditions, airway may be priority. If the by correlating ABC, airway is the highest priority. However, we need to focus the condition of the patient. For example, in conditions such as foreign body obstruction, or food aspiration, like that, some throat obstruction is there, airway is the priority. Because if the airway is not meeting, the obstruction is not meeting first, the client will go into respiratory arrest and death of the patient. And in some condition, breathing is the issue. For example, in COPD patient, those patients with the respiratory condition, breathing is the highest priority. Because when there is a lung inflammation, what will happen? For example, bronchial asthma. Okay, in a bronchial asthma, what is the particular patient is allergic to some dust, pollen, or anything. Okay, if the person is exposed to such allergen, the client will experience what inflammation. Okay, because of the bronchospasm. So when there is a bronchospasm, that means the narrowing of the bronchus. What will happen? The inhale of the oxygen and exhale of the carbon dioxide, that the gaseous exchange won't take adequately. Okay, at that time what will happen in the alveoli is not the gaseous exchange is not happening in a proper way. For that, what will happen? The carbon dioxide will trap in the lungs and client will experience breathing difficulty. Okay, so the such client will face hypoxia because of the inadequate oxygenation of the blood. And also the client will feel breathing difficulty and the nasal flaring. Okay, if in a scenario which is giving or information such as inadequate oxygenation, breathing difficulty, nasal flaring, that indicates that hypoxia. So the hypoxia needs to be managed first. Then circulation. For example, if the patient is deficient in blood volume or fluid volume, we can evaluate the patient condition by assessing the vital signs, especially blood pressure and heart rate. And for example, if the patient is hypovolemic, what is hypovolemia? Inadequate blood volume or inadequate fluid level in the body. Okay. When there is a low blood volume, what will happen? The blood which is reaching into the heart will decreases. So the cardiac output will decrease. When the cardiac output, that I will show in the normal blood circulation, I will explain it. Don't worry about it. Okay. So when the patient having decreased the output, the heart will try to contract more, because to maintain the perfusion, the heart will try to maintain the perfusion, the heart will contract more. So the patient heart rate will get increased. Okay. So tachycardia will experience, BP fall because of the decreased cardiac output. And also inadequate tissue perfusion, the client will get cyanosis. That means Lewis discoloration, pallor, and pulses will be diminished pulse or pulselessness. That means compromised circulation. So, in a scenario, if it is a ABC priority, we need to focus on the complaint of the patient. By assessing the complaint, okay, by assessing on the condition of the patient, we can understand, we can analyze what is the priority of the problem. That means whether airway need to be managed first, whether breathing need to be managed first, whether circulation need to be managed first. Like that, we can understand. Okay. Hope you understood about the criteria. Next, I will tell about, just I am mentioning about the Nugent types only because of the lack of time. Okay, if you want this strategies, I am not included here in this Nugent type. Okay, here the most of the Nugent type is I have mentioned here. First one is the case study. Case study means it is a 6 series question. They will give some case scenario and they will ask question one by one. Okay, fine. Finally I will show the types of the question. Okay, and the bow tie question. In a bow tie question, they will give some one problem in the center. Right and left, they will give action and the outcome. Like that is the bow tie question. And the matrix grid means it is like the match the following like question. Okay, multiple responses might be there, but it's like match the problem will list in the left side, right side, the solution, like that. Okay. Then drop down type question means there is a condition of the patient and if there is a given any action, okay, nursing action and the rationale behind it. Sometimes they will show the trend in the vital signs. For example, previously I have said whether the condition has changed or unchanged or improved, like that they will mention. Then extended drag and drop means they will give some scenario and some option. We need to drag the option in the priority order. For example, tube feeding. Okay, tube feeding or to rice tube insertion. It is a procedure. So they will give the question in a wrong order. We can make it in the correct order by dragging each options. That is the drag and drop question. And last one, highlighted question. Highlighted question means they will give one scenario. Okay, and they will give the question. For example, in the scenario, they will give the patient has brought to the emergency department with chest pain, patient have dyspnea, like that, and the patient is already non-case of arthritis, and the patient had undergone for surgery 2 years ago, like that some scenario they will give. And the question may be the may be related to highlight the conditions which is related to the myocardial infarction. Okay, so we need to read the scenario and highlight the conditions which, for example, chest pain, dyspnea, then pallor, whatever the heart related or circulation related informations are there in the scenario, we can highlight that particular scenario. Okay, I will show it in the last. That is the main type of Nugent question. Okay, actually in case study, this one question may be select that all that type question. Second question may be matrix grid question. Third question may be drop down type question. Fourth question may be simple multiple choice question. Fifth question may be highlighted question. Last question may be SATA question. Actually, these are the main Nugent types. Okay, including select all that apply. And in a case study, in a Nugent case study, they will ask the Nugent type of question in a 6 series question. Okay. Then I have already said about the scoring. Okay. Actually, if we are giving a correct answer, we will get 1 mark. If we are giving wrong answer, we will get the negative mark. Negative mark means totally they will end 0 only. They won't reduce our mark further. Okay. Then some points have partial credit also. And something always we should gain about the negative marking. So some students, what will happen like here and there they will get. Even they won't read the question, they won't analyze the options, they won't correlate the options. Okay, while reading scenario, read the by reading question, they will simply select one answer even without thinking. That is the wrong method. Don't use it. Okay, even the question is a familiar question, we know the condition of the patient, always correlate the options. Okay. Next, in content criteria, usually based on the ATP. ATP means the nursing process. Okay. A means assessment. Okay. D means diagnosis. P means planning. That I means implementation. Last means evaluation. That means for giving care to the patient. Okay. How we can give care to the patient? By assessing the patient first. After that, we will understand the problem of the patient. Then, according to the prioritization of the needs of the patient or prioritization of the problem of the patient, how we can prioritize? We can use the Maslow's hierarchy or ABC priority. Okay. And also we can use Bloom's taxonomy in assessing or analyzing the patient. Then we have to plan the care. Okay, what for example, I hold if a patient first will be in ABC, what is the important one? That will be the first nasal diagnosis. Then activity, nutrition, exercise, physical activity, mental support, psychological support, like that it will come in the lower side. So always focus on the priority of the problems or priority of the needs of the patient. We plan the care. After that, whatever the planning we are giving, or the the activity should have a scientific rationale. Okay. And after that, this planned activity we can implement in the patient. Okay, that is giving care to the patient. After the evaluation means, after giving care to the patient, whether the condition is improved or worsened or unchanged, like that we can evaluate. That is the content criteria. And also some other points include client need category. That means safe and effective environment care. Always we should focus on the priority. Our priority is patient. Okay, as well as our healthcare professionals also priority, but our while giving care to the patient, always our priority should be patient. We need to take care of the patient first. We need to save the life of the patient first. Okay. Second thing, health promotion and maintenance. That means whatever the care we are giving to the patient, always keep in your mind that we are giving care to promote the life of the patient or to maintain a good health of the patient. Okay. Third one, psychosocial integrity. Always we should give a therapeutic communication with the patient. That means we should approach the patient in a non-judgmental way. Always we should listen the patient. Okay, we need to the healthcare professional, especially nurses, should be a good listener. The patient may have many things they can. For example, if one patient got admitted to the hospital, he may go through different scenario. For example, one thing, he is physical illness. Second thing, family or the family is alone. Third thing, the patient may have financial struggle. Then how patient stress level may be increases. Like that, patient will go through in a different issues. Okay, so we have to understand the patient. Then also physiological integrity means the care should not harm the patient. Okay, always protect the patient. Always try to save the life of the patient. And other integrated process include, first thing, while giving care to the patient, we can use the ATP. ATP means nursing process. A, assessment, B, diagnosis, planning, implementation, and evaluation. Next, we should care the patient. In addition, we have to give health education to the patient. For example, if a patient is a diabetic patient, we should focus on teaching the management of the blood sugar level. If the patient is a hypertensive patient, we should focus on maintaining the normal BP to reduce the salt intake, reduce the water, heavy activity, like that, reduce the stress, like that. We have to give the health education. Okay. So then always respect the culture and spirituality of the patient. For example, some persons eat only vegetarian diet. Okay, non-veg is not eaten by some patient. That we need to admit, or we need to respect their rituals or respect their culture. And our activity or our communication won't harm the patient. Okay. And always respect the culture and spirituality. Some category of people won't receive blood from others. Okay, that we should respect. We can't compel that. No, you have to take the blood, otherwise you will get into die, like that. We can't compel the patient. We can focus on the care. Meanwhile, we have to respect the culture and spirituality of the patient. Okay, that are the main. Actually, these points are the important criteria in each question. What are the questions you are dealing in after this webinar? Whenever you see one question, you will focus on whether it is a cultural spirituality, infection control, nursing, psychosocial integrity, physiological integrity. For example, physiological integrity, example, fall prevention. That means when the patient having fracture, or when the patient is having osteoporosis, or the patient is having seizure, there is a risk for fall. So always focus on the fall precaution or safety of the children. Okay, that means the child abuse, interpartner violence, like that we should focus on it. Always give a our primary focus is to give a comprehensive care to the patient by respecting the culture, spirituality of the patient, and also maintaining the psychosocial and physiological integrity. Okay. Why we are giving care
Yes,
to
yes.
promote the health and wellness of the patient and for the maintaining care to the patient. Always we provide a safe and effective care to the effective care environment to the patient. That means we should provide or we should prioritize one. But the thing is that always respect the patient, that provide privacy. Okay, whatever the care we are giving, we should provide privacy to the patient. These are the some content criteria. Actually, some more points are there to explain it, but limited time is there. Okay. So to succeed this Nugent Nclex examination, the most of the important strategies I have mentioned in this webinar. What are the criteria we need to focus? What are the criteria? Um, Bloom's taxonomy, clinical judgment model, then prioritization of needs using Maslow's hierarchy, then ABC priority, then other content criteria that meeting the needs of the patient, what are the physiological integrity, psychosocial integrity, then nursing process, and respecting the spirituality, respecting the culture of the patient. Okay, so that are the main criteria which are some students fail to understand this criteria. Okay, so always keep in mind that it is actually Nclex examination is a different level examination. Only thing is that we have to be consistent in our preparation. We can crack it in our first attempt itself. But I am repeating again, rather than hard work, we have to use smart work so that we can we can make this exam come true. Whatever is our dream, we have to focus on that. We always, our dream should be visualized. We can write somewhere in a diary. That will come under the mind strategy. Okay. Hope the criteria get a clarity. Anyone have any doubt? You can ask. Any doubt to anyone? I don't know who are joined here. If you have any doubt, you can ask to me about the criteria. Okay. Till now, we are focused on once again I will report that goals we have discussed, common mistake done by the students we have discussed, then why the Nugent Nclex examination has prepared by the NCSB and that to hire or to get a internationally qualified nurses. Also, we are focusing on the some criteria, ability, clinical judgment ability, problem solving ability, infection control ability, prioritization of the needs of the patient is done by the nurses or not, whether the nurse is able to delegate the duty, whether the nurse is able to maintain the therapeutic communication, whether the nurse is respecting the culture and spirituality of the patient. Okay, all these criteria are assessed by the NCSBN by conducting this Nclex examination. Okay. These are the framework. What are the clinical judgment model, Bloom's taxonomy, Maslow's hierarchy, then ABC priority. Okay, then I discussed about the Nugent question types. I gave an idea about the 6 series case study question. Then scoring also, mark scoring. Then what are the content criteria also? The usually the what are the things we need to follow while giving care to the patient, and this all these criteria should be followed. But if we are using it in a smart way and if we are doing a focused learning, actually for this Nclex examination to cover the syllabus, minimum 3 months is needed. By my experience, I am saying, I don't know about your minimum. If any nurse is a beginner or they need minimum 3 months to cover the syllabus. And also along with the theory practice, they need to focus on the question analysis also. Okay. They can focus on the, nowadays the so many free questions are available in the Chrome for examination. For example, Nclex.com, Simple Nursing, Nurse Lab, so many free sites are there, but this in a limited time period only. But those who are beginner, you can means log in, you can sign up and log in. Then you can understand what are the main types. While even if the answers is wrong, also no issue. You just practice. When you are practice, you will get an idea. This is the way. And always you read the answers of the right answer, rationally of the right answers as well as the wrong answers. If you are doing it in a correct way, For example, if you are doing one question about this, today I have selected myocardial infarction, so that only I'm saying that topic. If you are doing one question on myocardial infarction, you should get an, or you should acquire some knowledge from by doing that question. That you should keep in your mind. Simply practicing question and leaving or doing one question, okay, next question, leaving next question, that won't help you. Even you are assessing or if you are doing one question, if you are doing it in a productive way by focusing on the scenario, focusing on the question, focusing on the option, you will get a clarity. Okay, you will get a clarity. In addition, you will get understand, and it will save the time of the next question. Okay, if we are, for example, in a bow tie type question, you are making repeatedly mistake. So you practice 2 to 3 bow tie type question. By practicing one, if you are doing one question practice, you will get some idea. Second time, you will get some more idea. Third time, you will get some more idea. And the fourth time, you will conquer that type. You won't make mistake in future. Like that, you should have a goal while practicing the question. We need to crack it. We need to crack it in our first attempt. Always you should, whatever the PDF, whatever the online PDF, whatever, for example, Saunters, Lipin got, so many textbook are available online PDF for that textbook also is available. We can buy it. But you should have a short note. You should have a nutshell theory that will help you in your on the when you are going into your examination. At that time, it will help. At that time, won't work the textbook, won't work all this PDF, because we won't get much time to go through all this PDF. But if you have a nutshell theory about each condition, while doing question itself, you can make it into small point. At that time, you will get more clarity. When before approaching to the examination, no, you can just go through it, so you will get a idea about it. Okay, so we have to build our confidence. Okay, how we can build our confidence? We should sometime while entering the exam hall, we feel somewhat anxiety, and I felt in my exam time when I enter into that biometric evaluation room. No, at that time I thought my mind is blank. Nothing is coming into my mind. Really, I am saying that may be the experience by most of the students. Okay. But you don't panic that I forgot everything. I don't know anything. All the things what I have spent a lot of time to study, but nothing is remembering. No, you ignore all those points. You just stay calm, take a deep breath, and try to whatever you believe. If you want to pray, you can pray. Some person will do meditation. You can by sitting, some deep breathing or some anything, whatever the relaxation method. If you are practicing, you can do it there, so your mind get clear. Okay, without tension, without fear, you can enter into the exam hall. Okay, initially those who are beginner, they will find some difficulty with the means the instructions to follow, but there are persons to help us. They will help us. Okay, after that, you should think, or not think, you believe yourself. Always, we should develop a positive mindset from the beginning itself. It is a journey. Okay, there is a destination. Destination either pass or fail. But you should not think on the failure of the examination. You always think about the positivity. Okay, if we are attracting positivity, we will get positivity only. Okay, if you are thinking about you will crack the examination, okay, you will write somewhere in your personal diary something that I have conquered this exam on this month. When you are planning to write your exam, you write this month name, okay, and on the date in which you are planning to take the exam, you write in advance that you have passed the examination. After that, one thing is that you visualize that you are telling your family, you are telling your friends that I have cracked this Nclex examination, and how their response is like that. You just visualize and imagine, so that it will come true in your future. Okay, don't write I will pass. You write I passed the exam. I passed the Nclex examination, like that. And not only to write it, you just visualize it. If you are doing so, the positivity will come true in one day. Okay, not in one day, in the first attempt itself. But you have to follow the criteria, follow the strategy, practice question, learn theory. All these things need to be done in a correct way. And You need to pray well, you need to practice well, and put your smart work, get the result. That is the correct formula. Okay. And also daily minimum questions should be practiced. Minimum 85 questions should be practiced. Actually, by purchasing any Archer or Google, we can do readiness assessment or a CAT examination. CAT means computer adaptive test. That will determine that whether we are means eligible to near the passing, whether we are meeting the passing standards or below the passing standard or average or above, like that we can assess by doing the readiness assessment. And in CAT, if we are doing, we will get a pass or fail result. And tutorial mode, if we are doing, we will get the percentage of the mark. Okay, don't focus on the percentage. Always focus on to give maximum correct answers, and your score will automatically improve. Your readiness assessment score will be improved, and CAT will, you will get pass only. Okay. Then always you, whenever, for example, I always said 3 month minimum we need to complete the syllabus, and 4th month you always focus on your question practice. That is exam model question practice. Okay, real, when you are practicing this question, you think that it is my final examination, like that we are doing. That will alleviate your fear and anxiety about the particular examination. Okay, so when you are going for examination, you feel that yes, I am already done it. And when final exam also, you can done it in the same way. Don't make too much confusion. Don't make overthink, thinking in your mind. Don't make it confused. Okay. So always stay positive and claim positive. So this is the model which I have shared, that this is the clinical judgment model. First thing, we need to assess the condition of the patient, then prioritize the need, analyze the scenario, recognize some cues with the learned theory with the clinical scenario. Then we should take action, then evaluate the outcome. That is the main summary. So I have covered most of the means criteria and strategies. One more thing I want to share with that, main strategies in question analysis. That is, I have actually all these points I have discussed in in previous talking. Okay, first thing, keyword scanning. I already said that by assessing the question, when read a scenario, after reading the question, we can find out keyword. Okay, that keyword should locate in the scenario and scan that particular area. Those who are written any languages like IELTS or OET, they know about the skimming and scanning. Skimming means just getting an overview. Scanning means we are focusing on the particular point and we are reading carefully. That means we are analyzing. That is the scanning. Okay. First main strategy is the keyword scanning. Second thing is the elimination power. That means we are dealing with any question, we need to eliminate the wrong answers. Okay. If you don't know the answer itself, if we know the correct method of elimination, okay, we can eliminate the wrong answers. Then we will automatically find out the correct answer. Then priority pyramid. I have already discussed the hierarchy of the Maslow's hierarchy pyramid. Then time management. That also I have said. Always you should the time limit. Then you practice question. If we are practicing it in an effective way, we can crack it in our first time. So I am stopping here about the criteria. I want to discuss about one theory. Okay. So shall I continue? Anyone have any doubt on the strategies and criteria? You can ask. Those who are able to switch on your camera, please switch on it. Then only it will get more effective for you. Okay. If you are possible, if you are on duty, I won't recommend. If you are at home or in a safe place, you can switch on your camera. Okay. Any doubt? Any doubt? If you have any doubt, you can ask to me about this Nclex. Not about this other general thing that you can ask later. I am asking about this, whatever the points which I have discussed. Anyone have any doubt, you can ask. Can I continue with the this theory? Okay?
Yes, ma'am.
Okay. Okay. Please wait, I am taking the next video. Okay. This is about the normal blood circulation. Okay. How many of you know about the normal blood circulation? Just I will give you an overview only. I don't have much time to explain it in a detailed way. I will give you an overview. Okay. This is our normal blood circulation. Okay. See how many parts are there in our heart, chambers are there in our heart. How many chambers? Anyone?
Four.
Four chambers. Can you please tell me, Sumed, what are the four chambers?
Right atrium,
Right.
right ventricle, left atrium, left ventricle.
Very good. Thank you. Okay. This is the normal. It is the cross-sectional picture of the heart. Here we can see that. Sorry. The heart has mainly four chambers. As Sumit said, right atrium, right ventricle, left atrium, left ventricle. Okay. So, in our body, we have oxygenated blood and the deoxygenated blood. Okay. And in the blue color, it is deoxygenated blood. That means impure blood. That means the oxygen is lacking in this blood. And the red, we can see that is the oxygenated blood, that is oxygen-rich blood. So we should know how the blood is becoming oxygenated because there is a process. The main organs involved in this process is the heart and lungs. Okay. We can see this is the superior vena cava. Hope you can see the picture here. Superior vena cava. Here it is the inferior vena cava. Okay. The superior vena cava and the inferior vena cava collects the deoxygenated blood or impure blood. The superior vena cava collect blood from the upper part of the body and inferior vena cava collect the deoxygenated blood from the lower part of the body. Okay. And these venous, the major veins, what will happen? The carries this blood into the right atrium. See in the picture itself, we can see the superior vena cava is opens into the right atrium. Inferior vena cava is also opens into the right atrium. Okay. Then the blood collected in the right atrium. Okay. And this blood, which when the atrium filled with blood, it pumped into the right ventricle. Okay. Here one valve is there which controls the blood flow from the right atrium to the right ventricle. That is the tricuspid valve. Understood? This tricuspid valve is the gatekeeper of the right atrium to the right ventricle. And this deoxygenated blood is received in the right ventricle. Here we can see see the pulmonary artery is originating from the right ventricle. From the picture itself, you can understand. Okay. Where the area where the right ventricle opens into the pulmonary artery, there is one valve. Okay. Valve means which controls the flow of the blood. Okay. That valve is called the what? Before the pulmonary artery. So it is a pulmonic valve. Okay. From the term itself, don't need to by heart anything. You just understand it. Okay. Just if you are listen properly, you will get a clarity. So no need to by heart anything. You just easily understand it. Okay. So here one valve is there, pulmonic valve. Then when the blood filled in right ventricle, this pulmonic valve will open and it will blood will opens into the pulmonary artery. Okay. And this pulmonary artery, we have two branches, right and left pulmonary artery. This pulmonary artery carries this deoxygenated blood and it reaches into the lungs. Okay. In the lungs only oxygenation is taking. That means gaseous exchange is taking place in the lungs. Okay. Usually helping alveoli are mainly helping for this oxygenation of the blood. And after the oxygenation, what will happen? The blood will convert into oxygenated blood. That means it will become oxygen-rich blood. And this blood is carried by the pulmonary vein. Okay. Only in our body, usually arteries carry oxygenated blood, veins carries deoxygenated blood, except pulmonary artery and pulmonary vein. That means pulmonary artery here carries deoxygenated blood. And this pulmonary vein carries oxygenated blood. Understood? Only the artery and vein which carries in a wrong order is the pulmonary artery and the pulmonary vein. Usually arteries carries oxygenated blood and veins carry deoxygenated blood. Okay. After the oxygenation from the lungs, this oxygenated blood is carried by this pulmonary vein, and this pulmonary vein is opens into the left atrium. Okay. This blood is opened into the left atrium, and when the left atrium fills with blood, here is one valve, that is bicuspid valve or mitral valve. Okay. Here is two cuspids are there, so that only it is saying bicuspid. Here tricuspid, there are through leaflets are there, so that only it is tricuspid valve. Okay. And here this when this blood filled with left atrium, this bicuspid valve will open and the blood flows from the left atrium to the left ventricle. Okay. And here we can see the aorta is originating from the left ventricle. And before the aorta, one more semilunar valve is there, that is aortic valve. Okay. We have two AV valves, that means two atrioventricular valve. That is, what are the two atrioventricular valve? Here, between the right atrium and right ventricle, which valve is present? Which valve is separated by this right atrium and right ventricle?
Tricuspid valve.
Tricuspid valve. Very good.
Tricuspid valve.
There. And this left atrium and left ventricle is separated by the
Bicuspid valve or
bicuspid
mitral valve.
valve. Very good. Bicuspid valve or mitral valve. Okay. So two AV valves are there, two semilunar valve. One is pulmonic valve. Pulmonic valve, where it is situated? Pulmonic valve.
Right ventricle.
Right ventricle to the pulmonary
Pulmonary
artery. Okay, very good. And this aortic valve is situated in the left ventricle, and this when this aortic valve opens, blood flows from the LV to aorta. Understood? And it is when this aorta pumped into the blood through the aorta is pumped, oxygenated blood into branches of aorta, abdominal aorta, like and it is continuous with the artery, and the heart is supplied by the coronary artery. Okay. Like that is the normal circulation. It is an overview only, not a detailed circulation, just to make you understand. Okay. How many of you have any doubt on the circulation? Anyone can please explain the circulation, just for my satisfaction that you got the idea. Who will explain? Just 1 minute can take and explain it. Sumedh is smiling, so you
Yes,
can.
ma'am, I can.
You can.
Yes. Okay. Uh, the heart is composed of four chambers: right atrium, right ventricle, left atrium, left ventricle. And the blue portion we are seeing is that right atrium and right ventricle. It carries the deoxygenated blood, which is received from the superior vena cava and inferior vena cava. So inferior vena cava and superior vena cava carries deoxygenated blood to the right atrium. And from the in between the right atrium and the right ventricle, there is a wall. It is known as a tricuspid wall, which controls the flow of deoxygenated blood from right atrium to right ventricle. And from the right ventricle, the deoxygenated blood goes to the pulmonary artery,
Yes.
and where the blood is oxygenated in the lungs, and from the lungs, then it enters into the left atrium via left pulmonary vein. Oxygenated blood goes to the left atrium, and from left atrium, it goes to the left ventricle via mitral valve. Hello, ma'am.
Yes, yes, okay, well, you can
And
continue. Actually, one thing I need to add there, not only left pulmonary vein, we have two pulmonary veins, right and left pulmonary veins are there, and it is
right and left
both
right,
carries blood into the left atrium. That is the one thing I want to add it. Okay, you continue.
right. And that's it.
No issue. You can continue. Left
That's what
ventricle
I
filled with blood.
understand.
No. Left ventricle filled with blood. Then what is next?
Then from left ventricle, the blood goes to the body, means to the body parts organ uh, via the aorta.
Aorta. Very good. Thank you, Sundar, for
Yes,
giving.
right.
Okay. And the heart is supplied by the coronary artery. Then aorta is divides into branches and supplies to the whole body. Okay. So hope you understood about and clarity about the normal blood circulation. Okay. How many of you have still confusion? Because it is happening in our body only, not in others' body. But still, many of us don't know how the circulation is going on. Okay. So we need to understand what are the things. For that only, I am saying you. Actually, it is what we need to visualize the scenario. Okay, visualize the thing, then we will get what we won't get confusion about it. So make it easily understand. And hope Sumed has not by hearted it. You just say what you understood about that from the class. Is it? Or have you
Yes, ma'am.
by hearted the thing which I have taught? Have you repeated the same, or have you understood the circulation?
No, ma'am, I have not repeated. I have understood.
Understood. Thank you. Thank you for your response.
Yes.
Okay. Hope you understood. Next, I just give you an idea about the myocardial infarction. I will discuss one question. Okay. So myocardial infarction means it is from the term, actually our heart has three layers: pericardium, myocardium, and endocardium. The myocardium is the middle layer, that is the muscle layer. This myocardium is responsible for the contraction of the heart. Okay. So this contraction and relaxation of the heart is which is helped by this myocardium. When the heart contract, okay, I want to make it from the picture itself. See, when the heart contract, what will happen? See, when the we have atria and ventricle. When actually the circulation is not in a way that first the oxygen blood, then no, both are happening at the same time. Okay, when the atrium contract, at the same time, blood from the right atrium pumped to the right ventricle, left ventricle pumped into the left atrium to the left ventricle at the same time. Okay, not in a different time, at the same time. When the ventricle contract, what will happen? Blood flows from the RV to pulmonary artery, LV to aorta. Okay, understood? So you should imagine, actually I taken one video also, but 1 minute. I will show you later. Otherwise it will get so late. Okay. So when the heart contract, what will happen? At the same time, what will happen? This atrium contract. Actually, when atrium relaxes, okay, when atrium relaxes, blood from which is collected by the superior vena cava, inferior vena cava runs into the right atrium. At the same time, pulmonary vein collect blood from the lungs to the left atrium. Understood? When the atrium relax, who will contract? Ventricle will contract. Okay. So at that time, RV, blood from the RV pumped into the pulmonary artery, blood from the LV pumped into the aorta. Okay. So it is happening simultaneously. Atrium contract, blood squeezes from the atria to ventricle. Then ventricle contract, blood pumped into the pulmonary artery and the aorta. Like that, simultaneously it is happening. Understood? One more thing, actually, in addition to circulation, I want just give an idea about the conduction system also. Here we have some, the nodes are there which produce impulses. That is the SA node. SA node is situated in the right atrium. Okay. When the right atrium, this SA node in the right atrium produces impulses, then it transmitted into the AV node, which is present in between the atrium and the ventricle. Okay. And this impulse, when transmitted to the AV node, atrium contract. And when this from the AV node, this next bundle, right and left bundle branches, then Purkinje fibers. Okay, Purkinje fibers. When this impulses from the AV node is transmitted into the through the Purkinje fibers into the wall of the ventricle contract. Okay. So that means I just want to add the point that when the impulses transmitted over the atrium contract. When the impulses transmitted over the ventricle contract. Okay, that means when the heart contract, ventricle contract, some electrical activity is happening. Okay, that will explain with the ECG. Before that, I am moving to the MI portion. Myocardial infarction, that means the heart muscle layer will get what necrosed because of the lack of blood supply. That is mainly due to the coronary artery occlusion. Actually, this coronary artery occlusion is done by either plaque or thrombus. Thrombus means clot formation. Plaque means some atherosclerosis. That means this I will show in the picture. See the picture. Here we can see that this is the blood vessel. And here we can see one plaque. That means this blood vessel is occluded by a thrombus or a plaque. Plaque is the what this fatty deposition which is happen or which leads to the hardening of the blood vessel. That means it accumulated in the this wall of the blood vessel, and this will make into it what it will make the blood vessel harden and can lead to vasoconstriction and will obstruct the blood flow through the blood vessel. See, normal blood vessel has, this is the normal blood vessel with no occlusion, without no occlusion. See, here it is the atherosclerosis. That means some either calcification. Calcification means hardening of the blood vessel by the plaque or due to the thrombus. Thrombus means blood clot. Okay, this will cause occlude the blood vessel and it obstruct the blood flow. See, here in the first picture, we can see that this is the one coronary artery. Okay, this coronary artery, and we can see the inside of this coronary artery in this picture. Here, this coronary artery is occluded with this thrombus or plaque. What will happen? The blood flow through the particular blood vessel get blocked, like traffic jam. Okay. See, we are moving through through a road. If there is a traffic jam, can we move into the next stop? No. That means we will stuck in that particular area. Same only here, the blood will stuck in the particular area and it will obstruct the blood flow. What will happen? Where this artery is supplying into the heart muscle, that area, there is a deficient supply of the blood. Okay. When there is deficient blood supply, what will happen? The supply of the oxygen also will get affected. That means decrease the oxygen supply, which leads to hypoxia and can lead to necrosis of the particular region. See the color changes in the muscle layer in the picture itself. In the second picture also, we can see the muscle got damaged because of the hypoxia. Okay. So, and this is the myocardial infarction. Myocardial infarction means the myocardium get infected or necrosis because of the inadequate blood supply. It is mainly occurs due to the atherosclerosis, either plaque or thrombus. Okay. So the main risk factors we can divide into two, modifiable and non-modifiable. That means some things or some factors we can't make it change. For example, our age. Actually, 1 minute is going, our age is advancing. 1 hour is going, our age is progressing always. We can't make changes in the age. Like gender-wise. Okay, usually this heart disease are common in the male gender. And in the family history. Okay, if family history, if anyone have any history of this, any cardiovascular diseases, there is a not only cardiovascular, that is related to any disease condition. Genetic has some impact on the transferring of diseases from generation to generation. Like that here, if there is a family history of any cardiac diseases, there is a risk for getting cardiac disease for their offsprings. Okay. Next is modifiable risk factors. That means modifiable. That from the word itself, we can understand that the factors which can be modifiable by some activities. For example, modifiable risk factors. Actually, these risk factors will lead to myocardial infarction, but if we are managing it in a proper way, we can reduce the risk of or reduce the severity of the disease conditions. What are the modifiable factors include? Smoking, hypertension, diabetes mellitus, obesity, sedentary lifestyle, hyperlipidemia. That means in smoking, what will happen? One substance, nicotine. That nicotine will accumulate in the wall of the blood vessel, which can lead to the hardening of the blood vessel. Finally, it can lead to vasoconstriction and it occlude the blood vessel. Okay. Hypertension also. In hypertension, that means BP is blood pressure is the resistance which is exerted by the blood against the wall of the blood vessel. Understood? Actually, when our students know how I am explained. When we are passing water through a pipe, okay. So if it is a narrow pipe, what will happen? If we have 1 glass water, okay, and we are pouring this water into a smaller pipe, it will feel some resistance to go. Okay. But if the pipe is have wider, if you are pouring 1 glass of water, we won't get much difficulty in flowing the water. Same like only due to the vasoconstriction, the BP will get increases because of the increased vascular resistance. Okay, so the client will develop increased BP. The increased BP greater than 140/90, that is called hypertension. Okay, this hypertension will cause what? Either plaque formation or the rupture of the blood vessel can cause. Then diabetes mellitus, obesity. Obesity also same. What will this high cholesterol level will cause the hardening of the blood vessel. Sedentary lifestyle means without the person who is doing moderate activity. Such patients, this fat deposit, the risk for fat deposition will be higher, and with hyperlipidemia, that means higher level of the low density lipoprotein, not high density. High density lipoprotein is a good cholesterol, and low density lipoprotein is the bad cholesterol. If there is a sedentary lifestyle, all these risk factors can cause hyperlipidemia. Okay, these are the modified risk factors. But making some changes, for example, modifying our lifestyle changes, modifying our dietary habits, modifying our exercise habit, we can make it what change in the risk factors. For example, if stress is also another factor for cardiac diseases, but doing some relaxation technique, meditation, then some therapies of stress management can reduce the stress and reduce the risk for getting myocardial infarction. See, the risk factors I have already said. When there is a hyperlipidemia or low density lipoprotein is higher, what will happen? It will accumulate it again in the wall of the blood vessel, and either it can cause the hardening of the blood vessel or can lead to clot formation, thrombus formation, and it will occlude the artery and can lead to drying of the muscle. The pathophysiology I have said already. What will happen? This thrombus will occlude the artery. And the main steps involved in this pathophysiology, first, thrombus or plaque will occlude in the artery and it will rupture and will formed into thrombus. Otherwise, when there is a platelet aggregation also, the platelet are responsible for the clot formation. When the platelet got aggregated or accumulated in the blood vessel, it can lead to thrombus formation, and this thrombus can lead to occlusion of the blood vessel. In both cases, it can lead to obstruct the blood flow, and finally it can lead to decreased oxygen supply through the blood, because when there is a lack of blood supply, which leads to lack of oxygen supply. Finally, what will happen? Myocardial ischemia. Ischemia means lack of oxygen, hypoxia. When there is no oxygenation is happening, what will happen? Necrosis of the particular area, necrosis of the muscle layer. And if it is if the hypoxia is existing greater than 20 to 40 minutes, it can lead to necrosis. The particular site will get infected or necrosed depending on the artery which is affected. For example, left anterior descending artery, right coronary artery, left circumflex artery, like that. The area of the location of the thrombus will determine the severity of the myocardial infarction. And the main clinical features include, we know that there is a decreased blood supply lead to hypoxia. When there is a hypoxia, the client will experience chest pain. And usually this chest pain will radiate to the left arm, jaw and the backbone. Okay. And the pain, the severity will be greater than 20 minutes. And if it is not relieved by rest, and even after taking the nitroglycerin, we should suspect for the MI, because all chest pains are not myocardial infarction. Sometimes the client will experience angina also. Angina, how we can differentiate is that if the patient chest pain is relieved by rest or after taking nitroglycerin, that is angina. But if the patient chest pain is not relieved even after taking adequate rest or nitroglycerin, that is myocardial infarction. Okay. And because of the hypoxia, what will happen? The client will develop dyspnea because of the compromised pulmonary circulation. Client will experience diaphoresis, anxiety, nausea and vomiting, and tired feeling the client will experience. That is impending doom feeling. And some patient who is with, if the patient is a diabetic patient, there are more chance for getting silent attack. Okay. Silent attack, that the client won't experience much chest pain. He will experience syncope, fatigue, like that only. That may be the silent attack. So these are the main clinical features, and the main diagnostic measures include ECG. Okay, ECG means when there is a myocardial hypoxia, which can lead to ST segment elevation. That means sometimes ST elevated MI or sometimes non-ST elevated MI. That means STEMI and NSTEMI. Those who are working in any ICU or cardiology department, they may be familiar with this STEMI and NSTEMI. I don't have much time to explain detailing. See, this is the normal ECG, this is the P wave, this is the QRS complex, this is the T wave. Okay. And the P wave denotes the atrial contraction. See, you should imagine that when the atrium contract, what will happen? Okay. So when atrium contract, what will happen? Atrial depolarization means contraction. Repolarization means relaxation. The P wave denotes the atrial contraction or atrial depolarization. QRS complex denotes the ventricular contraction or ventricular depolarization, and T wave denotes the ventricular repolarization. Okay. See, this is the QRS complex. This is the T wave. In some patient, this ST, see, we can see the area, ST segment. This ST segment will get elevated in case of myocardial injury. Understood? That means when there is atherosclerotic event occur, either due to plaque or thrombus, we can occlude the blood vessel, lead to decrease the blood supply, hypoxia, necrosis of the myocardial muscle. Okay. So we can see in MI the ECG ST elevation. See, like the ECG will be like that. Okay, this is the J point where this QR ending of the QRS complex and the beginning of the ventricular relaxation. That point, that is ST segment will get elevated. Okay. That is two types of MI. STEMI, I already saying it is a nutshell theory, not a detailed theory. Okay. Sometimes we can see a pathological Q wave also. And to diagnose this myocardial infarction, the cardiac markers. That means when there is a myocardial injury, the main the enzymes will get activated. Okay. For example, TROP-T, TROP-I or TROP-T or CKMB. That means this creatine kinase these are the enzymes which are present in our muscle. When there is a muscle injury or myocardial infarction, the level of TROP-T or CKMB will get elevated in the blood. Okay. Usually when the patient is brought to the emergency department with chest pain, to rule out whether there is any myocardial injury or a cardiac related disease, we will do the TROP-T test. When the TROP-T is elevated, we will do the management for the MI. Okay. Usually this TROP-T will be elevated within after the myocardial injury, it will elevated within 3 to 6 hours. So that only we are giving health education that when the patient is experiencing chest pain, we should immediately take the patient to the nearby hospital. Otherwise, what will happen? This infection will get worsened and it can lead to cardiac arrest in the patient. Okay. And this TROP-T level, when there is a myocardial injury, the TROP-T will begin to elevate within 3 to 6 hours and last for 7 to 14 days. After 14 days, it will become normal. And this level of the CKMB also, it will rises within 4 to 6 hours, but it will become normal after 3 days. That means that between 48 to 7 hours, 78 2 hours, it will become normal. And while doing echocardiogram, we can see the wall motion abnormality because of this, because contraction relaxation will affect it. So the ventricular wall motion will get affected because of this atherosclerosis. Blood flow will get interrupted. Okay. Main complication, if the myocardial infarction is not managed promptly, it can lead to complications such as arrhythmia. I have said that means abnormal production of the impulses which can lead to abnormal contraction of the heart. So the heart rate will get increases, arrhythmia, cardiogenic shock because of the decreased cardiac output, then heart failure, then ventricular aneurysm means the ventricular wall will protrude because of this inadequate blood supply. Then pericarditis, inflammation of the pericardium. These are the complications which occur after myocardial infarction. Okay. Main important management to manage the MI, that is mnemonics as MONA. MONA means M means morphine. Morphine we are administering especially for the pain management and for the preload reduction. Preload means it is the blood in the ventricle which is before the contraction. Okay. And during the contraction, the resistance of the muscle contraction, that is the afterload. Because before beginning the contraction, that means before when the ventricle relaxes, from the atrium filled in the ventricle. So the ventricle will get filled with blood. and that before starting contraction, that the end diastolic work, okay, that is called the preload. And during the contraction, some resistance in the muscle, flow of the blood will occur. That means the resistance in the aorta. For example, during the ventricular contraction, blood is flowing into the aorta. Okay, this if the aorta has some resistance in the flow of the blood, the afterload will get increases, preload and afterload. Then oxygen is what in we should administer oxygen, because what will happen in the client is getting hypoxia, so it can lead to inadequate because of the inadequate gaseous exchange. So the patient saturation level will get below than normal. Normal is 95 to 100. So the oxygen saturation will get below the normal. So the client need to get the support of oxygen. So we administer oxygen. Next one, nitroglycerin. I already said this is due to this myocardial infarction is occurring due to the vasoconstriction because of the thrombus or plaque. So we need to dilate the blood vessel. So nitroglycerin will do the role of vasodilation. That is what nitroglycerin. Next one is aspirin. Aspirin is an antiplatelet aggregator. That means it prevents the formation of the clots. Okay, when the platelet is responsible for clot formation. Antiplatelet means it prevents the aggregation of the platelet. That means it prevents the thrombus formation. This is the immediate management. How we can remember as MONA. M means morphine, O means oxygen, N means nitroglycerin, A means aspirin. Other than that, we have thrombolytics. That means if there is a thrombus, we can administer thrombolytics. Okay. Then anticoagulant also, heparin is an anticoagulant. It will prevent the further clot formation. Okay. What are the existing thrombus which is lies by the administration of thrombolytics? For example, streptokinase, altipase, like that some drugs are there, thrombolytics. It will lyse the thrombus. But anticoagulant, by administering anticoagulant, that means for example heparin. Okay, heparin will prevent the formation of, prevent the further clot formation. That is the main difference between thrombolytics and anticoagulant. Stool softness means which will reduce the, which will soften the stool, because if the patient is having chest that increase the workload, if the patient is straining for the bowel movement, what will happen? The cardiac workload will get increased. So to reduce the cardiac workload, we can administer with the stool softener. Then sedatives also. Sedatives to promote the sleep in the patient. Okay, these are the main management. Next management is the immediate management. Percutaneous coronary angioplasty, that is the stent placement. Actually, the door to balloon time usually it is 90 minutes. That means when a patient brought to the hospital with chest pain, we should, if there is a suspected myocardial injury, we need to do angioplasty. That is primary PCA. Primary PCA we have to done within 90 minutes. That is commonly saying that door to balloon time. Door means hospital door. Balloon time means balloon angioplasty. That is door to balloon time is usually within 90 minutes. I will show the picture here. I will explain. See, this is the atherosclerotic blood vessel. That means here is the blood vessel is narrowed or obstructed by this plaques or thrombus. Here what will happen? We will insert one catheter which is tipped with balloon stent. Okay. And when it is inserted and it's guided at this occluded part. Next step, this balloon get inflated. See, when the balloon get inflated, the stent will open and it will compress the plaque. Okay, when the plaque get compressed, what will happen? This plaque will rupture. Okay, the plaque, so it will widen the space of the blood vessel. Next, we will keep the stent in place and will remove the catheter. It can be done either radially or femorally. Radial artery or a femoral artery, we are preferring to insert the catheter. Okay, and after stent placement, what will happen? This the blood flow or the perfusion through the particular blood vessel get re-established. That is the angioplasty. Then thrombolytics, I have said, if the in the hospital, if there is no facility, because all the hospitals not have the facility for a angioplasty. Okay, so in such scenario, we can lyse the thrombus using thrombolytics. For example, altiplase. Okay, but it should be do within 12 hours. Otherwise, what will happen? This thrombus will occlude the blood vessel. It can worsen the hypoxia. It can lead to cardiac arrest or complications like arrhythmia and cardiac death. Next, beta blocker. Beta blocker means actually, for example, beta blocker, betalol, LOL drugs, labetalol, metoprolol. These are the examples for beta blocker. Then AC inhibitors, example, that Aspril, enalapril, like that. Okay. Then statin means lipid lowering agent. Lipid lowering, for example, atorvastatin. Okay, statin family. Anticoagulant, I already said heparin. Okay, heparin, warfarin, but here usually promoting the heparin. Okay. So these are the main drugs used in the myocardial infarction. And our role, this is very important. Our role, first we need to assess the pain. Here we should all the criteria which I have taught. What are the Bloom's taxonomy, clinical judgment, then Maslow's hierarchy, the nursing process, all the things we have to be in our mind while assessing a patient. Okay, assess the pain, assess the vital signs. Here we can monitor the heart rate, oxygen saturation, blood pressure, cardiac monitoring. We can see any ST elevation. Okay, and by assessing the oxygen saturation, if it is low than the normal, we can administer oxygen. Okay, and for the pain, what we need to administer? Pain management. Which drug?
Morphine.
Morphine is a pain management. Next one is administer oxygen. Oh, okay. Then IV access for administration of the nitroglycerin. Okay, you just imagine Mona, then we can you can create the management itself. Okay, why we are accessing means maintaining an IV access to administer nitroglycerin. Okay, then provide, and also one more thing. Usually this NTG we are giving in a oral tablet way. For example, we are giving 3 doses in a 5 minutes apart. Okay, nitroglycerin, oral nitroglycerin. And that is, if the client is relieved the chest pain, it is okay. That is because of the angina pain. But if it is not administered, even after the administration of the oral nitroglycerin, if it is not relieved, we can suspect for myocardial infarction. So we don't delay for bringing the patient to the hospital, because sometimes the client needs what? Either thrombolytics, not sometimes the patient. If it is a myocardial infarction, the client needs either thrombolytics or percutaneous coronary intervention. Okay. So, and also we should provide a calm environment to the patient, because to reduce the stress. Okay, we should give support to the patient, mental support, and we should stay with the patient, and we can give health education to maintain the lifestyle modification, to modify the modifiable risk factors. Okay, for example, diabetes control, hypertension control, cholesterol intake. Then we can give health education to reduce the fat intake, and reduce the oily food, bakery items, and increase the water, fruits and vegetables, reduce the meat, like that. What are the diet which will lead to hyperlipidemia can be limited. Okay, and also health education. For example, lifestyle modification, we can promote the physical exercise, we can promote walking. Okay, like that, some exercise also can be applied. And here, while giving care to the patient, always we should think about MONA. MONA means morphine, oxygen, nitroglycerin, aspirin. Okay. Then usually, but in a real life, sometimes if it is in a patient is having severe hypoxia, we need to administer oxygen first, because to maintain that is important point, because sometimes, okay, sometimes when assessing this myocardial infarction question, because scenario will be like that only. We will suddenly select the nitroglycerin or morphine. No, if it is according to the assessing the client condition, if it is mentioning about hypoxia, okay, in a saturation, low saturation, or symptoms of dyspnea, we should administer oxygen. Then what will happen? This hypoxia will get managed, so the infection, the risk for further infection can be prevented. And aspirin, why we are administering aspirin? What is the action of aspirin? Any other one other than?
Aspirin for function, anti-inflammatory, anti-pyretic,
No,
and
no.
antiplatelet.
Here, why we are administering aspirin?
Antiplatelet.
Yes, very good. Anti-platelet. Yes, of course, as someone said, I don't know, but aspirin is having some non-steroidal anti-inflammatory power. But here, aspirin is mainly focusing for the prevent the
Antiplatelet.
platelet aggregation. And nitroglycerin, what is the action? Any other one? Zoom user. Who is the name? Zoom user. I can't see your face. That's why I'm asking. Zoom user. Or next one, Annamalai. Annamalai, what is the action of nitroglycerin? Please unmute it. Don't worry. If it is wrong, also no issue. Okay, we are just a discussion class only. Then only we can analyze the question. If you understood about the particular point, okay, then we can means analyze. Already our time has gone. Then only even then I am still continuing. Then I just want to make it clear before I set the time limit. But if I am not concluding the point and if I am not assessing or evaluating, I have started assessment, analysis, and finally in the stage of evaluation. Okay, if I are getting a correct response only, I will decide. I can get an idea that the webinar will be an effective for you. Okay, anyone, please tell me what is the action of nitroglycerin?
Vasodilation.
And morphine?
Morphine analgesic.
Analgesic.
And the NSA opioid
Opioid
analgesic.
Very good. We can analyze one question here. Only one question I am analyzing because time is okay. Here we can first, whenever we are getting a this new gen question, we should see the scenario. Okay. Here the actually I means from the scenario I have selected categorized into different parts for making you to understand easily. Okay. First one, we should look for the background information of the patient. That means whether the patient is male or female, whether what is the name and how old the patient. Okay, here the patient name is Raj, 58-year-old male. Okay, and then look for any history. Then patient has a history of hypertension, smoker for 20 years. That means the patient is a chronic smoker. When we see that the patient is a chronic smoker, you look for what will happen? The blood vessel will get narrowed or there will be a normal blood vessel. What will get? That it will, from while reading itself, you can go into a easy diagnosis. So that will I am saying. Because in a chronic smoker or in a smoker patient, if it is a longer years of smoking history, his blood vessel will be narrowed because of the nicotine. Okay. So and also it is said that patient is having hypertension. Okay. So that is the main history in the patient. And the patient is presenting complaint. What are the complaints patient is presenting? The sudden severe chest pain, which is radiating to the left arm, diaphoresis, nausea. Okay. Next, vitals, I will ask you to analyze it. Okay. Then vital signs, here it is mentioned in 90/60. So to rule out whether the BP is normal or it is low BP or hypertension, we should know what is the normal BP. Okay. Actually, in the Nclex question, the lab values and all the most of the lab values they will give it. No need to by heart anything. Okay, but some things like this we need to by heart. By heart means we need to understand what is our normal heart rate. Our normal adult heart rate is 60 to 100. Okay, 60 to 100. Normal blood pressure in adult is 120/80. And normal respiration is 16 to 20. 16 to 20 is the normal respiratory rate. Normal oxygen saturation, that means normal SpO2 is 95% to 100%. Okay. And by I have already said, you mentioned somewhere what is the normal level. By assessing that, what you are feeling? What are the changes in this particular patient? Beena. Bina, already we know what are the normal vital signs. Okay, see, Here, what already patient is having chest pain, which is radiating to the left arm diaphragm. By assessing the vital signs, as a nurse, what you are feeling in the condition of the patient?
Blood pressure is a low blood pressure
Mm.
and heart rate also tachycardia
Mm.
and respiration also not normal and saturation also lower.
Okay. So, when a patient is having low BP and tachycardia, what we should suspect for? Why this BP low? Why this heart rate high? I already explained previously, so that only I am asking. Why the BP is low?
Bleeding or
No bleeding. It is nothing mentioned about bleeding, no. Here the patients complained only severe chest pain radiating to left arm diaphoresis and nausea. But here patient is BP is low. What may be the reason? Anyone? Why when the BP will actually what is BP? How we can? BP is the blood flow that the blood is exerted some pressure against the wall of the blood. That is the BP. Here, if it is BP low, that indicates the low cardiac output. What is cardiac output means? The amount of blood which is pumped out by the heart. That is the cardiac output. Okay. Here BP is low. That indicates that the cardiac output is low only. Okay. Already it is mentioned that heart rate is 110 beats. That means to compensate the cardiac output, the heart is pumping, or not pumping. The heart is trying to contract more to compensate the cardiac output. Okay. Because of the inadequate perfusion only, the client is getting low saturation also. And by assessing the respiratory rate, normal adult respiratory rate is 16 to 20. Here, the respiratory rate is 22. That means the client is having breathing difficulty. Okay, because of the hypoxia. Already low cardiac output is there, tachycardia is there, the patient has breathing difficulty also, and saturation level 92%. Saturation level 92% means that the oxygen supply is deficient only. That indicates hypoxia. Why the hypoxia? Already patient, what are the things we can see in the scenario? Patient is having chest pain which is radiating to left arm diaphoresis and nausea. By assessing the vital signs, we could know that one the patient is struggling with the hypoxia. Then we can look for ECG. Already we have some what suspect about some cardiac disease. Okay, then we can look the ECG, and the ECG showed ST segment elevation in the lead 2, 3 and the AVF. Okay, and also while assessing the lab, okay, you got an idea that the trop I is elevated. Okay, so by understand that the client is having chest pain, client is having hypoxia symptoms, client is having ST elevation, client is having positive trop T. What may be the possible diagnosis here? Possible diagnosis. In which condition chest pain radiating to left arm diaphoresis, the left arm, and the client experienced diaphoresis, nausea, vomiting? In which condition?
MI.
Myocardial infarction.
Yes, myocardial infarction. We can see in the patient that chest pain is radiating to the left arm. Okay, and here it is we understood. Okay, we assess. See, we nothing is even directly. Only vital signs. From the vital signs, we could understand that the client is has an issue with the hypoxia. Okay, already the ECG shows ST elevation, so it is a ST elevated MI. Okay, understood how you conclude the diagnosis, and how from the complaint and from the vital signs we can't confirm it as a myocardial infarction. How we confirmed it as a myocardial infarction? What is the what lab value shows? Trop I is elevated here. When the trop I elevated, trop I or trop T is elevated, what it indicates? Remesri.
It's a it's an enzyme which that elevated
Hmm.
and 3 to 6 hours after the after occurrence of myocardial infarction.
Yes, and that means when there is a myocardial damage or myocardial injury, the trophy will get elevated and some CKMB also get elevated. So by assessing these things, we could understood that the client is experiencing with the myocardial infarction. Okay, so by assessing, actually here I have used scan method, but then if it is in a scenario, first we use skimming, then we have to focus scan on this particular point. How that we can go with the this question. Okay, here the question is priority nursing. That means the multiple response type question. Here the question, this is the question. That means which nursing action should the nurse prioritize immediately? Okay, here from the scenario we could understood that the client is experiencing with the chest pain, dyspnea, and the hypoxia. Okay, so we can read the options. Administer oxygen via nasal cannula. Okay, see the in the scenario whether the client need support of oxygen. Here the saturation is 92%. Is it needed? Oxygen support?
Yes.
Ginseng? Is it needed?
Yes, ma'am. Yes, ma'am.
Why it is needed?
Saturation is 92% only.
Yes, saturation is lower than the normal limit. So the client need oxygen support. So we can select option A as the correct answer. Okay. Then second thing, obtain IV access and prepare for nitroglycerin. Is it needed?
Yes, ma'am.
Why? Because
Nitroglycerin is a vasodilator. We need to
because already we got here. See the question how it is asked. Whether they have given any diagnosis. This is the way the Nugent questions will be. Okay. Whether we have how we only diagnose from the scenario. Okay. So we should, what are the methods we have applied here? We just assess the patient, chest pain, vital sign. Then we analyze with the scenario, we analyze the fact with the patient problem. Okay. Then we got an idea that the patient is suspected for myocardial infarction. How we confirmed it as a MI? Elevated trophy. So we confirmed it as a myocardial MI. So we should then we don't look for any other management. We can focus on the MONA. That means the myocardial infarction management. Okay. So in the MONA, it is the one thing is the IV, getting IV access and prepare the patient for the NTG administration. Okay. And third one, call the cardiologist for percutaneous coronary intervention. Is it needed? Next, another one. Chemistry told okay. Is it needed? Whether is it need to call the cardiologist for the PCI? Because already we got the diagnosis that what is the MI. Okay. So when there is a suspected MI, what is the time duration between the door to balloon time? Within 90 minutes. Okay. So immediately we should call the cardiologist. Okay. And we should arrange for a primary PCI or percutaneous coronary intervention. Okay. So we can select option C also. And last one, we can provide, last option is provide teaching about lifestyle modification. Yes, of course, we can give the lifestyle modification, but in the question, what it is asked? It is asked about the priority nursing action. So, by comparing the options, this teaching, provision of the word lifestyle modification can be given later, not an immediate management. What are the immediate management? Administer oxygen, administer IV access, and prepare for NTG and call the cardiologist for the percutaneous coronary intervention. Understood? This is the way we have to analyze the question. We can read the rationale also. Yes, oxygen help to increase the myocardial oxygenation in a hypoxia patient. And IV access and the nitroglycerin is needed. That is to administer the medications because nitroglycerin is a vasodilator. Next, we can call the cardiologist because if the patient need the percutaneous coronary interventions to correct the STEMI, because it is already shows ST elevated MA. In an ST elevated MA, the client need urgent reperfusion therapy. Otherwise, it can lead into arrhythmia and cardiac arrest. And teaching can be later. That is not a priority management. Okay. Hope you understood about the question analysis. I have limited time only, so I am analyzed one question only. Okay. Anything you want to ask anyone about the classes and whether it was useful or not? Can you please, anyone can tell me whether the webinar, because before the webinar and after the webinar, how you feel it about this Nclex? Whether you got some idea or not?
What's the difference in prop and property?
What?
Difference in drop and property. We are assessing property for MI, but what if drop is elevated
Actually,
or
no. Both are that is only both are cardio enzymes only, cardiac markers only. That is according to the hospital availability. Either we can do the trop T or trop I. Okay. Here it is mentioned trop I only. That is enzyme only. That is only the difference I and T. That's only. No issues. Cardiac enzyme only. Either we can do trop I or trop T. That's all. Okay, if it is elevated, we can suspect for a myocardial damage because this enzyme is released when there is a this myocardial muscle layer got injury or damage. This enzyme will released, and one more muscle that myoglobin. Myoglobin also released when there is a muscle breakdown, and this can the level of the myoglobin also get increases and. When the patient, we can notice the myoglobin in the it is eliminating through the urine. Okay, that means myoglobinuria can be noted. Okay, so this is the enzyme only. So have you got any clarity? I didn't explain in a detailed way. I just given an overview only. I just want to make you the question, means what are the criteria, strategies in the question analysis. Simply means giving an explanation won't get an effect. So that only I have chosen one topic and given that one nutshell theory can helpful for a question analysis. Okay. Oh, then if it is effective or no, you can message me. If you want to join the class also, you can let me know. Hope it was effective for you. Okay. Thank you. Thank you for joining. It is already 30 minutes late. Then you can message me. Then Anna, one actually, Beena Jinsi, my student, Anna Male. Don't know. He's not talking. Okay, you can message me, Sumit. Okay, thank you, Joan. And then hope you got a clarity about the Nclex. Okay, thank you for joining. Okay,
Yes,
and you just send me either voice message. Those who are participated the class, no, you just send me a voice message or type message, text message. You can send me. Okay.
okay.
Okay. Thank you. Thank you so much. Okay.
Thank you.